This semester we have special microbiology and we will talk about specific infections. This topic for today is zoonosis. You could remember from the last semester that we have classification of infections according to the source of infection. The first one is anthraponosis, which means from humans, anthropos. That means this infection can be spread just among human beings. We have zoonosis, zoo from animals, and such infections can be spread just among animals. We have zooantroponosis, which could be spread from animals to humans, and why you should underline that from animals to humans but not from humans to animals, because even if it's possible to send this infection from human to animal, but even if technically it's possible, usually it doesn't happen. It doesn't make too much sense. So usually it doesn't happen. Usually it is transmitted just from animals to humans. And the last one is sapronosis, sapros, which means decaying or rotting. Well, it is a case in which you can get an infection not from a living creature, but from dead organic substance, decaying or rotting organic substance. But you could observe that our topic was called not zooantroponosis but zoonosis, and it is not because we will talk about infections which can affect just animals, but because in medicine we are used to call zooantroponosis simply zoonosis. Actually, we will not discuss about strictly zoonotic infections which can be spread just among animals, because as doctors we are not interested in these infections. Such infections are target of veterinary services, but our target is everything related to humans. This is why, just to make it shorter, scientists, doctors are using for zooantroponotic infections, they are using this short term of zoonosis. So it is not a mistake, it is just a shortened form to call in medicine zooantroponotic infections. And a lot of zooantroponotic infections, they include some extremely infectious diseases. Extremely infectious disease can be classified in two groups. First group is disease which is unusual and may have serious impact on public health. That means basically by itself such disease is not necessarily extremely dangerous or not. But in some cases, in some specific circumstances, such infections could create a huge public health issue. And here you can see some examples of such extremely infectious diseases. In this list, we can find severe acute respiratory syndrome, or SARS. Coronavirus is making part of such diseases. So from a certain point of view, coronavirus is extremely infectious disease. It doesn't mean it is super dangerous in any case, but in a lot of cases, it is really dangerous. As well as you can see, children. For example, I'm working now in the children's hospital, and we have a lot of children infected with coronavirus, but the issue is not the health of children in this very case, because they are not making severe forms of coronavirus infection. But they are dangerous for mature people, for elderly, for grandmothers, grandfathers, for matures, because matures are those who are making severe infections. This is why we are to use this complicated equipment here, because the majority of our doctors are they have some age, so we don't have too much young doctors here. So it is kind of conditionally extremely infectious disease. But the second group is about diseases in which any event associated to this infection will assessed as dangerous. So whenever such infection will happen, it will be considered dangerous, extremely dangerous disease, which creates extremely dangerous situation for population. Such of that is cholera, pneumonic plague, yellow fever, Ebola. You could hear about Ebola a few years ago. It was outbreak.
And doctor, I'm studied about the cholera. It's a germ in the stomach, yes? Germ in the stomach, it's from the milk products.
Not really in the stomach, but in the gastrointestinal tract, in the
Yes,
in the intestine. So it just turns out the function of intestine, because if the function of intestine is absorption, whenever choleric vapor is getting
absorption. Yes.
yes, the liquids are getting out from the bloodstream in the cavity of intestine. So it starts severe diarrhea, watery diarrhea. And people are dying because of dehydration.
Maybe the germ is from the polluted water?
Yes.
Maybe?
Yes. Whenever the source of water is contaminated with feces of infected person, you are getting
also
infected if you was consuming such water. But we'll talk about this infection by another chance, in another lesson. Let's pass further. Since today we are talking about zoonotic infections, we will discuss a few of them. One of the pretty spreaded infections all around the world is brucellosis. It is spreaded because it affects domestic animals like cattle, sheep, goats, pigs, camels, and so on. So since people are using such animals for their agriculture works, for meat, for milk, well, for different purposes, such animals are used by humans, and they are living all the time nearby humans, especially in villages, in farms. This infection on the one point became an important problem. But at the same time, I guess you're not really familiar with this infection. Like even if you, some of you could live in the countryside, I'm sure that you're not, you don't really meet this infection day by day, because all the animals are supposed to be vaccinated. Usually, all the farmers, all the people who are keeping such animals are vaccinating them against different zoonotic infections. And another reason why we don't really meet this infection, because we have such thing as pasteurization. I guess all of you heard about pasteurization. That it is a kind of sterilization of the drinks, such as milk, such as juices, wines, and so on. So it is a specific way to decrease danger of infection. And I guess all of you heard about pasteurized milk. I guess nobody is drinking another type of milk except pasteurized milk. And this name comes from the French scientist Louis Pasteur, which invented this method of sterilization. Well, this infection is more spread in regions which have pure veterinary services, which have pure medical service, and in which people are not really familiar with such things like vaccination, such things like medication, antibiotics. So in less developed countries, in less developed regions. To make lab diagnosis of brucellosis, we need to pass two steps. First one is presumptive diagnosis, and here we are using specific serological tests, which are making kind of pre-diagnosis, which gives us the answer should we make confirmatory diagnosis or not, which is a little bit longer. And confirmatory diagnosis is, first one of course is isolation of Brucella from blood or other clinical specimen, and of course more other serological tests like ELISA, like Coombs, and PCR, which is highly used all around the world for every infection. Actually, you can apply PCR for every infection. Regarding prophylaxis, if we are talking about anthraponosis, like infections spread among humans, we are talking about prophylaxis for humans. Well, we apply some measures of prophylaxis directly for humans. In case of zooantroponotic infections or zoonosis, we will talk about prophylaxis for animals. So it is much easier to make prophylaxis for source of infection, instead making prophylaxis for host. So we will make prophylaxis for animals, and namely we will make vaccination of cattle, and for sure we'll make pasteurization of milk produced by such animals. The treatment is pretty easy, is pretty simple. We are using for treatment in both uncomplicated and complicated cases. We are using antibiotics. The only difference will be type of antibiotics, amount of antibiotics, dosage, and it will depend on how complicated this case and which is the age of the patient. Here you can see a schematic picture of fighting of our body with Brucella, and we can pass further. Here we can pass to the next infection. It is Bacillus anthracis. It is anthrax, an infection which became famous after 9/11, if you heard, in the United States, where certain terroristic acts, including a biological attack, and in that case were used anthrax, were used spores of Bacillus anthracis. What is characteristic for this bacteria? It is not really resistant in the environment, but it is able to produce spores. And spores, as well as you know, are extremely resistant in the environment. Here you can see how looks a skin lesion of anthrax. Anthrax can produce different forms of diseases. It can be skin infection, it can be respiratory infection, and it can be gastrointestinal infection. Well, this is how looks a skin lesion in anthrax. Usually spores of anthrax are present in the soil from infected animals. The animal is eating the contaminated grass and gets infected. When the animal gets infected, it dies, and or its meat is used for food, or other animals are eating contaminated grass from the same region and are getting infected. And also, since spores of anthrax can be found not just in grass but on the skin of animals, those who are working with skins of animals also are exposed to the risk of making this skin disease with Bacillus anthracis. Manifestations, as well as I told, we have cutaneous anthrax, skin infection. We have inhalation anthrax, which can affect respiratory system, and we have intestinal anthrax, which can affect basically every portion, every part of the gastrointestinal tract, starting from the tongue and tonsils and throat and till intestine. The mostly spreaded one is cutaneous anthrax, skin infection. It is pretty aggressive, but it is not that lethal as inhalation anthrax or intestinal anthrax. It is pretty treatable, and in order to treat this infection, you need general groups of antibiotics like penicillin. Mostly common antibiotics are effective for anthrax. Well, in that case of biological terroristic act with spores of anthrax, some people were receiving envelopes, mails with white dust, you could remember it, and they were this white dust were containing spores of anthrax, and people were getting infection with this disease. People were getting infected with this disease. Um, and the population were extremely panicked because they were afraid to not get such infection. Moreover, some people started making fun of that and making pranks, just buying some envelopes and putting some white dust inside and sending to everyone without any spores of any infection. But people were scared and somebody was making fun of that. So the panic in United States became too big. So people started looking for solutions, because you can know that not in every country you can buy antibiotics without prescription, and especially in US you cannot buy antibiotics without prescription from doctor. So some people started buying antibiotics from veterinary services, antibiotics produced for animals, and they were keeping such antibiotics as a reserve in case of they could get such envelope. They will have a reserve of antibiotics. But others simply went to Mexico and bought all antibiotics from pharmacies from there, because their people are not supposed to bring any prescription from doctor in order to buy antibiotics. So Mexico made a lot of money on Americans. Meanwhile, Americans bought a lot of antibiotics, which eventually created another problem, because this interdiction to buy antibiotic without prescription makes a lot of sense, because health system is to control antibiotic consumption. Not everybody knows how to use antibiotics. Not everybody is familiar to such things like dosage, like length of treatment. So such events can produce other health issues like multi-drug resistance. People will start using antibiotics just for prophylaxis of some infections, and they will produce multi-drug resistant strains of different infections, and will create another problem, that whenever somebody will get that infection, on that time none of antibiotics will be efficient against this infection, and people will start dying because of multi-drug resistant forms of infections. There are a lot of issues which can go one from another one. This is why it is extremely important to keep situation under control. Well, in lab diagnosis we can apply gram staining, the mostly simple one. In the gram staining we'll see that it is gram positive. Also we can apply capsule staining, because anthrax has, except spore, it also has anthrax. It has capsule, and you will see under the microscope, you will see Streptobacillus, which, if you remember, Streptococcus is spherical shaped bacteria arranged in chains. Well, anthrax is Streptobacillus. It is a rod arranged in chains. And you will see endospore, which doesn't change a shape of bacteria. The spore is inside, and in some places you will see capsule as well. Selective culture media can be used for diagnosis, for cultivation. And of course, serodiagnosis. In serodiagnosis, we are looking for protective antigen, we are looking for edema factor, and we are looking for little factor. Well, we have antibodies which respond against such toxins. We apply them, and we are looking for the result. Prophylaxis is the same. We have to vaccinate domestic animals. And the treatment also is pretty simple. We apply antibiotics. Independence of how severe is this infection, the same result we will have. But the infection is pretty treatable with antibiotics like penicillin. Another infection we can discuss is Yersinia pestis, or plague. I guess all of you heard about this disease. It used to create few pandemics during the human's history, and this image is characteristic for periods in which people were dying because of plague. It was kind of a suit of doctors in outbreak of plague. So it is an infection which produces, as well as I told, produced few pandemic outbreaks, and It is a pretty aggressive infection, which also is pretty treatable with antibiotics. But the biggest problem were that in period this infection used to be pandemic, antibiotics didn't exist. They simply didn't exist, and a lot of infections could be treated, and a lot of pandemics could be stopped in mid-age, a lot of big period ago, if humanity on that time would have antibiotics. But antibiotic is pretty young medicine, so this is why just recently we started treating some diseases which used to be considered as extremely dangerous and extremely complicated. Anyways, plague is a very aggressive infection which can produce also a few forms, but the mostly big danger is in the fact that this bacteria firstly goes to lymphatic vessels. Well, lymphatic vessels and lymphatic nodes which are getting infected with Yersinia pestis are swallowing, are increasing in size, and from lymphatic nodes this bacteria can get in the bloodstream and produce septicemia and can lead to death. It is a pretty aggressive infection. Meanwhile, it is treatable with antibiotics. Well, incubation period is about 2 till 6 days. What is interesting about plague? In mid-ages, since we know that plague is transmitted by rodents, by rats, and from rats it is transmitted to humans usually by flea. So in mid-age, you could hear about such events like hunting witches. A lot of people were looking for witches to find them and to kill them. And in that period, cats were considered like kind of, I don't know, maybe assistants of witches or kind of devil's animal. So cats also was killed with were founded and killed with witches. Sounds weird, but it is fact. And in a lot of villages, in a lot of cities, cats simply disappeared because it was not really a good thing to find a cat. If you don't have cats, you have a lot of rodents. You have a lot of rats. They were killing cats, and rodents were multiplying with extremely big speed. And plague were sent from rodent to rodent, from rat to rat, and fleas were sending plague from, were transmitting plague from rats to humans. In this way, a lot of people were dying, entire villages were dying, and they needed to burn the entire village because there wasn't any healthy person there. It was extremely dark period. This is why the plague is called Black Death. Here you can see how looks buboes from caused by plague. Well, it is inflammation, swelling of lymph nodes. In this case, we have axillary lymph node swallowed by plague. And here you can see example of gangrene, also caused by Yersinia pestis. And this is a flea which transmits infections from animals to humans. Lab diagnosis: in every form of plague, we can take blood for culturing, because usually you will find in the blood the bacteria. In bubonic plague, the mostly simple way to find bacteria is to aspirate from lymph nodes, and for sure you will find something there. And in septicemic plague, for sure you will take firstly the blood. Post-mortem, which means after death, every kind of lymphoid tissue, like spleen, like lymph nodes, and so on, can be taken as a specimen. But basically, post-mortem you can find the pathogen all around the body. So this is why we have such big amount of samples we can use for diagnosis. And we will use some serological tests to find antigens, to find antibodies, and of course we will use microscopy. Not just culturing, not just cultivation of bacteria, but also we will see it under the microscope. Prophylaxis of plague is very simple: disinsection and deratization. Disinsection means killing of all the insects, applying of some chemical substances which can kill all the insects, and deratization is killing, extermination of rodents. If you will destroy the source of infection, of course you will stop spreading of the infection to humans. And the treatment as well is with antibiotics in dependence how severe it is.